We're at two of this country's busiest emergency departments, spending a day shift inside one and a night shift outside another. Following doctors, talking to patients, and tracking their wait times. Getting an up-close look at an emergency care system in crisis. It's early morning at Sunnybrook Hospital's ER, and the chief, Dr. Justin Hall, is starting his shift.
Morning, May.
Many of the patients he's about to see have been waiting overnight.
I'm just going to turn the light on, sir, if that's all right.
John's been here since 2 a.m.
Can you tell me what's brought you in today?
Well, I have difficulty finishing a breath.
Okay.
Waiting for 7 hours. And as Dr. Hall orders more tests.
Can we do a walk test for him?
He'll likely be here for much longer. This Toronto hospital is the largest trauma center in the country. Roughly 200 people come through daily. Last year, the median length of stay for patients was 8 hours and 13 minutes, meaning half waited even longer. It is the longest in Ontario. Data shows wait times across the country are getting higher. We've been tracking, and the numbers are stark. PEI's hospital with the longest wait is 5 hours and 19 minutes, and it just goes up from there, all the way to 13 hours and 3 minutes. That's Quebec's longest wait. Behind the data, there's damage.
8 hours and 22 minutes. What does that length of time mean to you?
It's a number I hate now. And it's 8 hours of 22 minutes that Finlay had to suffer.
In February last year, 16-year-old Finlay Vanderwerken had severe abdominal pain. His parents, Hazel and GJ, rushed him to the nearest emergency room in Oakville, Ontario.
I was so scared. I was just full of fear and wanted Finlay to get seen immediately.
Finlay was triaged at level 2 on the Canadian Triage and Acuity Scale, meaning his case was emergent. Guidelines say he should have been seen by a physician within 15 minutes. Instead, he waited for hours.
I had to go up several times to the nurse's desk and ask for them to come and see Finlay. He was having problems breathing and he was in so much pain, he was crying out.
Hospital records show every time Finlay's vitals were taken, his oxygen saturation kept dropping. 8 hours and 22 minutes after he arrived, Finlay finally saw a doctor.
Then everything changed. There were lots of people involved. The doctor knew at that point that something was wrong and action had to be taken.
By then, Finlay had sepsis, his body's reaction to pneumonia. He went into cardiac arrest. His organs began to fail.
You want your kid to be the miracle kid. And asking, is there a chance of a miracle? But there wasn't.
There's small comfort in us knowing that we tell our kids we love them every day. We know that Finlay knew. But what can you say in those last moments?
You've both had to endure something that no parent should have to deal with. Do you think that his death was preventable?
Yes.
Yes.
Dr. Fraser Mackay is with the Canadian Association of Emergency Physicians. They've been sounding the alarm about long wait times for years.
We know we work in a system that is falling apart.
So how often then are you seeing a patient and thinking to yourself, boy, I should have seen you hours ago?
Oh, every shift, undoubtedly.
His own ER in New Brunswick is no exception, and so he avoids going into the waiting room altogether.
When I have 40 pairs of eyes on me, and they just want eye contact because they want to be seen, they want me to know that they're waiting to see me and they're suffering, I know that, of course I know that. And that's a really hard thing to do. I don't know which of them is going to have a devastating diagnosis. I don't know which of them is going to get called in 5 minutes.
We're starting the clock on a 12-hour overnight shift outside St. Michael's Hospital in downtown Toronto, tracking how long patients who have come to this ER will wait.
Hey man, how you doing? My name's Chris, I'm a reporter with Marketplace.
Right away, we meet Anthony, who's just arrived by ambulance.
What did you come for?
So I've been sitting in pain for 2 days. My foot's swelled up twice the size. So, you know, I hope I don't need pins.
Well, I hope your wait isn't too long, but stay connected and we'll keep in touch.
All right, thank you.
All right.
Time passes. As we wait for an update from Anthony, we meet Jen, whose husband is inside.
How long have you been waiting here for your husband?
We've been here for 8 hours now.
Why did you and your husband have to come here to the ER today?
So he just has some lower back pain problems that just came out of nowhere while we were getting ready for my sister's wedding.
This is not how you were expecting to spend your sister's wedding day.
Definitely not. No, he's missed the entire thing.
It's now just before midnight, and as Jen heads back inside, we find Jonas in a lot of pain.
I have problem in my back.
Oh, your back,
Yeah.
okay. I guess they didn't give you any idea how long you might have to wait?
No, he don't say nothing. He say you need to wait.
And so she does.
What does it feel like when you think about all the patients that are out in that waiting room and you can't get to them quickly and treat them the way that you want to?
This is such a huge, overwhelming problem. It's when it's the individual patient, that's when it hits.
It sticks with you.
Yeah. Yeah, it sticks with you, and it's because it makes you question, are you good enough? And are you in the right job? And that's hard.
Is crisis the right word to use when we describe the system right now?
Crisis is a great word, other than the fact that it implies sudden. We've been very clear for many, many years. We know these problems, we know they're getting worse.
The problem is complex. Burnout is leading to staff shortages, and a lack of family doctors is pushing more people to depend on Emerge. But experts say the biggest issue causing long wait times is what's called boarded patients or bed block. ER patients who have been admitted to another unit in the hospital, but that unit is full, so the patient is left waiting in the ER. A few hours into Dr. Hall's shift inside Sunnybrook, we watch that unfold.
We have 31 patients who are admitted to the hospital but are remaining in the emergency department because there's no bed.
That's roughly half of your overall patients.
It is. Right now, that's
here
about
waiting.
half. Correct.
Okay, that sounds like a big problem.
It is. It's a big problem, and right now, this is sort of earlier in the day, but as the day goes on, this problem becomes more challenging. We start to see that number creep up.
Who's the longest right now?
The longest right now, who's still in the department, looks like about 36 hours.
36 hours?
Yeah.
Dr. Hall gets back to the patients who have yet to be seen.
I'm just gonna sneak behind you, thank you. Hello.
Hello.
Hi. And I understand you guys have agreed to have the team here as well. My name's Justin. I'm one of the emergency physicians. It's nice to meet you.
But shortly after, an interruption.
Apologies. Just give me 1 second.
An urgent update from our first patient, John, who's been in the ER for 9 hours now.
Okay, thanks for your help. Bye for now.
So John doesn't get to go home?
No, so John's gonna stay. He's got a few things going on. I'm concerned about his breathing.
So now essentially he's a blocked patient.
He will be. So as we were chatting about earlier, now I think we have 33 admitted patients from what I can see. I've now just added one more patient to that. So he will get seen by our specialist colleagues, likely admitted here shortly, and then he will wait for a bed.
So John stays waiting. Back outside St. Michael's Hospital, an update. It's 1 a.m. now, and I just got a text message from Anthony. He's one of the first patients that we met. He came in with a foot cast, complaining of swelling and pain, and he's just texting me to say that he's waiting for surgery now, still in the ER, some 7.5 hours into his wait, and we'll keep checking in. Coming up, patients fed up with waiting, walking out of emergency departments without care.
From what I know now, I did put myself in jeopardy.
That's after the break. We're outside Toronto's St. Michael's Hospital, tracking how long ER patients are waiting. It's 2 o'clock in the morning, and we meet Joyce, who had a sewing needle lodged in her foot. We have been waiting out here for hours. We've heard from at least 2 people who mentioned the girl who was screaming with the needle inside of them. And so I just can't even imagine how much pain you must have been in.
I was in so much pain.
Yeah.
I was in so much pain.
I'm so sorry.
Yeah.
What do you think of this 7-hour wait that you had?
It's insane.
Jen and her husband, who came in with lower back pain, are finally cleared to go home. Jen, my
Yes.
goodness. At the end of the day, how many hours was it?
It's been 10 hours in total.
Hours. How do you feel about this?
Exhausted.
Yeah. But Jonas, who's also been here for hours with back pain, is leaving without seeing a doctor. What are you doing right now?
I go home. Too many people waiting inside.
St. Michael's Hospital tells us they've experienced higher than normal demands for urgent care in recent months. They say they see the sickest people first, but see all patients as quickly as possible. I can tell you're in a lot of pain, so I want to let you go.
Okay.
But thank you. I hope you're feeling better.
Thank you.
Okay. She represents a growing number of Canadians leaving emergency rooms without being seen by a doctor. Last year, in Ontario and BC, about 5% of patients walked out. In Nova Scotia and Newfoundland and Labrador, 10%. It's about 12% in Quebec, Nunavut, and New Brunswick. And 2 provinces, Manitoba and PEI, have an even higher rate.
It's rare that a shift will go by where one of the patients I'll see isn't someone that was there yesterday or the day before and couldn't handle the wait and left. And now they come back, and now they're that much sicker.
In New Brunswick, where Dr. Mackay works, that breaks down to nearly 60,000 patients who walked out of Emerge just last year. We're on the road to meet one of them.
It was chaotic, it was loud, there was a lot of people that are just really upset about waiting.
Susan Gordon arrived at the Moncton ER by ambulance this past June. She'd been vomiting repeatedly and had sharp stomach pain. You know how they always ask you your pain out of a scale of 10?
I was at a 15 about that night.
Oh my God. But after more than 3 hours in a crowded waiting room, she gives up and walks out. And when you made that decision to leave, do you think you put your health in jeopardy?
From what I know now, I did put myself in jeopardy.
After leaving the ER, her pain intensifies until she collapses and ends up back in Emerge.
She said it's your appendix. I needed to have surgery, and they were doing it immediately.
So you went in with what you now know is appendicitis.
Yes.
And you didn't end up getting care. How does that make you feel?
It makes me feel like our system is broken.
Horizon, the health authority that runs the Moncton Hospital ER, tell us they don't want any patients to leave without being seen, and say the long waits are a result of blocked patients waiting for beds in overcapacity hospitals. They add they're trying to find solutions under these challenging circumstances. New Brunswick's Ministry of Health tells us they're taking steps to improve patient flow and increasing access to primary care to reduce pressure on ERs. Inside Sunnybrook Hospital, Dr. Hall is trying to prevent patients from leaving before they're seen by increasing overnight coverage using private donor dollars ensuring Sunnybrook will always have at least 2 doctors working the night shift, something that's not possible in many hospitals across the country.
Typically in the later evening and overnight were some of our longest wait times.
He says the time patients spend waiting before a doctor sees them has gone down by about 30 minutes.
Why is that so important, that metric of initial assessment by a physician?
So when someone's been triaged, but they haven't been seen potentially by the physician yet, that is a bit of a gray zone or a black box. We don't know what's there, and some patients might be getting sicker during that time. So the earlier we can see patients, the better that it is.
Patients like Finlay Vanderwerken, who waited more than 8 hours at the Oakville Hospital.
Do you think if a doctor set eyes on Finlay sooner, the outcome would be different?
Yes.
Yes.
When we see the hospital record, I want to read you a note from the doctor who finally assessed Finlay that morning. Unfortunately, there have been long wait times overnight. Current wait times are over 10 hours. He had waited 8 hours to be assessed. What do you think when you hear that note back from the doctor?
Anger.
Anger, frustration. If this is known, why is it still like that?
There's an acceptance. There's an acceptance that this is just how it is.
But they refuse to accept it, filing a lawsuit against the hospital and some of its staff. Halton Healthcare has filed a statement of defense, denying negligence. They tell us they've improved scheduling so there's more doctor coverage during periods of high patient volume, and add that in the past 8 months, the time it takes for that physician initial assessment at the Oakville location where Finlay went has decreased by more than 32%. But Hazel and GJ are advocating for greater change, including maximum wait times for children in the ER, calling it Finlay's Law, and calling on lawmakers to listen, starting with local city councilors, urging them to put pressure on the provincial government, and council agrees.
This region, this province and country let Finlay down, let us all down, by not paying attention to the data, everything that pointed and screamed that our healthcare was failing. So I say to you all, the time for action is now. Do not dismiss me or ignore me.
Ontario's Minister of Health is Sylvia Jones, and after months of asking, Hazel and GJ get a private meeting with her. We catch up right after.
Are you satisfied?
I don't think we are satisfied just yet. I was glad to hear the minister acknowledge that she's the one responsible for restoring the faith that we lost. So it's a good step, but more conversations will be needed.
Coming up, we go searching for answers from Ontario's Minister of Health.
Minister Jones, I'm Chris Glover with CBC Marketplace.
That's after the break. We're finding wait times in Canadian ERs are climbing, and the consequences are too.
I lost a son, and it didn't need to happen.
For weeks, we ask multiple times for an on-camera interview with Ontario's Health Minister, Sylvia Jones. We call, email, and text, but her office declines. Then we learn she's attending a Remembrance Day dinner in her riding, so we approach her outside ahead of the event.
Minister Jones, I'm Chris Glover with CBC Marketplace. Finlay, we've been trying to talk to you, and Finlay Vanderwerken's parents tell us that you took responsibility for restoring their faith in the emergency department system in Ontario. How are you planning on doing that?
Guys, I'm going into a Remembrance Day service.
We know this is an important day, but we've been trying to talk to you and get to you through your office for weeks.
So contact my staff.
We already did, and what we can tell you is we spent time in emergency departments as well as talking to patients.
We take her lead and follow up with her staff, asking again for an interview, but they never grant one. Her office sends a statement saying they've made record investments in healthcare in the past 3 years, including $44 million to tackle emergency department wait times, and they recognize there's more work to be done. But they still haven't responded directly to our findings, so we're here at the Ontario Legislature to try one more time. But she doesn't show up to question period. So we are left without answers. At the end of our shifts, inside Sunnybrook and outside St. Michael's, an update on the patients we met at the start. After 12 hours in Sunnybrook's ER, John still hasn't moved up into the hospital.
So he wouldn't be getting a bed on the ward probably anytime soon, just based on what I'm seeing.
And after some monitoring, he's offered the choice to stay and wait or go home. He decides to leave.
Sometimes patients will make the decision and say, actually, I'm gonna go home now.
But outside St. Michael's, Anthony doesn't get that choice.
Anthony is still waiting. He just texted me now. I am still waiting for surgery. He's still in the emergency department.
12 hours and counting. Some continue to wait for care and change.
He was just an amazing kid. And the world is not a better place for him not being in it. And it's our job now to use his voice to turn things around.